Dr. Balshi, thank you so much for joining us today. Really excited to have you. I want to take us back to the beginning of the pandemic. Can you tell us a little bit about how it started for St. Luke's and what you did? And in particular, I'm really interested in how you set up your communication and care process.
One of the things that was really important in how we had to respond was our location relative to New York City. Even though we're about 80 miles west of New York, we felt like we were part of the New York ecosystem. We had been using Microsoft Teams, and this gave us a tremendous tool to set up multiple command centers and to work virtually, even before it was required by our state government.
That's great to hear. And was Teams also used to coordinate kind of across clinicians and researchers and people who are working on various aspects of the problem?
Our pulmonary critical care team had been using Teams to collaborate across all of our campuses to refine and adjust our care plans. And as a result, we had a dramatically improved outcome curve with COVID patients in our network. I was really proud when our critical care specialists said they couldn't have done this without the collaborative platform of Teams.
That is awesome. That definitely warms my heart. The team here is so excited to be working on the product. I love what you have talked to me about previously about virtual visits and virtual rounds. Tell us what you've been doing.
Well, it's an interesting scenario in Pennsylvania because we had virtually no elective telehealth visits occurring. We were able to take our 1,500 providers and rapidly train them on Teams. And within about a 4-week period, we moved from 0 televisits to over 100,000 visits.
Wow, that's really remarkable. And those televisits, do they also reduce the strain on St. Luke's resources?
Yeah, at the same time that we were trying to adapt to the lack of ambulatory or outpatient visits, we were struggling with trying to preserve PPE. And then we worked rapidly with the Teams development group to put the Power App in place to allow us to directly connect with those rooms remotely and from anywhere within our network. So if I knew that Jared Spataro was in room 327 at the Anderson campus, I could just go to that room on the Power App and we could connect without Jared having to do anything other than say hello. This enabled us to have providers interact with the patients without having to consume the gowns, the gloves, the goggles, the face mask protectors.
That's great. I love to hear it. We're all in the period now when we're looking at what the future will be like. What's going to happen, do you think, with these technologies and the use of these technologies?
I think that the reluctance for telehealth virtually eliminated itself as we dove into this process. One of our primary care docs reminded me of my father's experience many years ago, where he was a primary care physician and told me that he had been in every house on the south side of Bethlehem.
Wow.
And now it occurred to me that a house call is it's a virtual encounter. So it really is something that is a surprising benefit to what has been really a devastating challenge for healthcare.
Oh, I really appreciate your perspective. And so I wonder if you wouldn't take a moment to just, give the people who watch this some advice, particularly other physicians or other folks who are using technology in a medical setting.
What we found with Teams, as opposed to all of the prior ways of using telehealth, this is a paradigm shift for the way we view the value of a doctor-patient relationship. And it can be very intimate and it can be very good. It certainly doesn't replace an face-to-face visit, but it is really important. We're going to find that it's going to change the way we plan and strategize about delivering care to our communities.
We at Microsoft, we really believe that the best technologies blend into the background. I hope we're getting closer and closer to that ideal in your circumstances.
I think we are. And I think especially when a network like ours has so rapidly converted in the face of this. I can't imagine doing what we do without having something as easy as Teams for these conference calls, these video visits, these collaborative meetings that we now have. It's really been game changer for us.
Well, that's wonderful to hear. Dr. Balshi, thank you